This is a prime destination for health and wellness exploration. This is where we deep dive into crucial health topics with insights from leading experts in the field. This is all about health.
Welcome to yet another episode of All About Health by AYOO Care. Live your best life. Today, we will discuss about women's mental health. In conversation with me is Dr. Aditi Singh, who is a Senior Consultant Psychiatrist at AYOO Care. Dr. Aditi has completed her MBBS from LTM Medical College, Mumbai, and she is an alumna of the prestigious institution NIMHANS, Bangalore. She has over a decade of experience treating disorders like stress and trauma-related disorders, OCDs, women's mental health, and adolescent health. Hello, Dr. Aditi. It's a pleasure to have you here.
Hi, Kisra. Glad to be here.
Dr. Aditi, why do we have to discuss about women's mental health as a separate entity? Are there any separate challenges they face as compared to the men?
There are discrete ways in which women's mental health differs from men's mental health. If we just look at the sheer numbers, or how common certain mental health conditions are in women compared to men, the numbers vary. There are certain conditions like depression, for example, and depression is a very, very common mental health issue that most of us have faced or would face in our life at some point. When it comes to women, at any given point in their life, they are twice as likely as compared to men to develop depression.
Okay.
So that also speaks about the vulnerability part of it. Now, owing to so many factors, including our biologies, specifically the hormonal changes that women experience during their life
Right.
at discrete points or cyclically, periodically, they make us very vulnerable, again, to developing emotional distress or mental health issues.
Right.
In addition, if we look at the social factors, women's lives in certain areas are very, very different from men's lives. The expectations are different. The challenges are different.
Right.
Even men and women have different roles in society to play across their lives. So both these roles obviously come with different kinds of challenges, but women do tend to face a little more challenges, especially if we look at the current scenario where we are caught up in trying to balance more modern roles
Right.
and expectations from life with, trying to maintain some connection to our traditional roles and values as well.
Okay.
And women often find themselves in the position where they have to balance all of these out.
Right.
That's a lot of pressure. Yes. It's a lot of stress.
It is.
And stress being the single most important factor that can, precipitate or increase emotional distress or any sort of mental health issue.
Okay.
So if we just look at that, there are a lot of differences between men and women when it comes to mental health.
Right.
Apart from that, how mental health issues present in men and women, the same issue, might also vary. Say, for example, let's talk about trauma.
Right.
Now, it's not like men do not experience trauma. Men also experience a lot of, trauma across their lifespan. But the kind of traumas women are exposed to are much more grave, much more serious.
Okay.
Say, for example, situations like abuse, assault, intimate partner violence, things like that. Now, these are the kind of experiences that make women much more vulnerable to developing trauma disorders, post-traumatic stress.
Okay.
Right? Also, if we just take post-traumatic stress and we see how it presents in men and women tend to sort of, externalize or take everything out.
Okay.
which means they might be more likely to be impulsive, engage in rash actions,
Okay.
say like getting into fights and brawls, or using substances to cope with
All
it.
right.
Whereas when women tend to internalize or keep everything inside, and they would be much more likely to experience depression or anxiety rather than, very, very obvious behavioral issues that people outside can discern,
Okay.
right? So there are just so many ways in which women's mental health is markedly different from men's. And I think it's very important to talk about it and for women to be aware of it.
Absolutely. So, seems like the women are more vulnerable to developing mental health conditions. Could you elaborate a little more on the factors that play an important role in these vulnerabilities?
Okay. So, like we just discussed, let's divide these factors into our biology
Okay.
and our environment, or the factors outside of us.
Right.
So, when it comes to biology, again, going back to the fact that women experience hormonal changes throughout their life
Yes.
in one form or at one stage or another,
Right.
that is a huge factor. We know for a fact from studies that both estrogen and progesterone, our reproductive hormones, have a major role to play in helping us manage, regulate, control our emotions,
Right.
control our anxiety,
Mhm.
and overall emotional well-being. They have a role to play. And it's not just about, the absolute levels of them, that, if my estrogen is high or low. Sometimes it's even the fluctuations. Like if the levels are changing rapidly, that itself can lead to disturbances in our well-being
Okay.
when it comes to emotional health. Also, if we look at the fact that when estrogen starts declining around the time of menopause,
Okay.
estrogen is also something that protects our brain. It keeps our brain healthy. It keeps our brain cells healthy. And when it starts declining, women again become very, very vulnerable to developing certain mental health issues. If we start from a woman's lifespan,
Okay.
around the time of menarche, young girls, they are a little more likely to experience emotional distress. It may or may not amount to a disorder, but a little bit of emotional distress. But when it comes to more pronounced changes, like the time around cycles,
Right.
most of the women out there, we experience mood changes.
Right.
70 to 80% of women might experience mood changes, anxiety, a slight bit of irritability, nervousness, restlessness, along with some physical discomfort.
Right.
We take it to be a norm and sort of sometimes dismiss it. But sometimes, in a small percentage of people, these changes can become very, very pronounced and very distressing. They cause a lot of difficulties in just carrying on normally with our day-to-day lives.
Okay.
But it's something that's very often overlooked. Again, because, it's normal. Just take it in your stride.
We say we are PMSing.
Yes, we are PMSing, but sometimes it's a little more than PMS. But it's not something we pay attention to.
Right.
Right? But that doesn't mean that those hormonal changes are not having a very, very marked bearing on our emotional well-being. Again, moving on to pregnancy.
Okay.
Pregnancy is a period in a woman's life that makes her extremely vulnerable to developing issues like depression, anxiety, worsening any issues that may already be existing.
Okay.
And it's compounded by so many other factors. It's not just that our hormones are changing, our bodies are changing. And you have to prepare for a very, very new role.
Right.
There's a lot of stress that women can experience during this stage.
Yes.
And that can contribute, again. The stress leads to release of stress hormones in the body, which are a different set of hormones. But again, all of this can just come together and it makes women much more vulnerable to developing depression. If I just have to make a case for how important it is to know that,
Right.
about 3 to 8% of women might develop diabetes during their pregnancy. But the number of women who may develop depression during their pregnancy or immediately after delivery can be anywhere between 5 to 20% roughly.
Just
Those
quite
numbers are much
alarming.
bigger, right?
It's quite alarming.
Yes, but when we go for health checkups during
Yeah.
pregnancy, we pay attention to diabetes, blood
Yes.
pressure, everything else, but not the expecting mother's mental health. It gets overlooked. Again, right after delivery, it's not like the body or hormones or our minds go back to being how they were.
Right.
It takes about a year for a woman to recover from all the changes. Until then, their bodies, their hormones, everything is in a flux. They continue to be vulnerable.
Mm-hmm.
And it may still be overlooked
Yes.
because, well, now we have to focus on the baby. But the point being that if the mother is not in a great place, she's not very functional,
Right.
that's not just going to impact her, that's going to impact the baby.
Absolutely.
If we just move on to the social factors we were discussing earlier, there are so many roles that women take on
Yes.
nowadays. And apart from roles, if we just look at the young women, adolescents, in general, adolescents have a lot of pressures on them nowadays.
Yes.
But young women specifically face pressures like body image issues, body shaming, bullying happening because of that. And that leads to an impact on how they see themselves, how much they value themselves.
Yeah.
Kind of shapes their sense of self sometimes if it's bad.
Okay.
And those kind of things can have a lasting impact on their overall well-being, right? It's not just something that's happening in the here and now. If my sense of self is not great, if I don't feel great about myself, it makes me vulnerable to stress and pressures down the line also in different situations.
Okay.
And stress is something that can precipitate or worsen emotional ill health in most of us,
Okay.
right? So some of the pressures we face can be so formative in terms of, how we deal with life's challenges.
Mm-hmm.
All the young women in urban areas nowadays, they are trying to balance very, very traditional gender roles with
Absolutely.
more modern roles. So they have to balance their work lives with their domestic responsibilities.
Right.
And most women out there, despite all the advances we've made in terms of, changing gender roles, still take on responsibilities of the household, childcare, etc. Imagine the amount of pressure it puts them in. They are juggling all of this.
Absolutely.
Again, that kind of paves the way for ill health if we don't take
Right.
care of ourselves. And we are not told to take care of ourselves.
Right.
So if we just look at this much, there is so much that makes us vulnerable.
Right.
It's so
Right.
important to be aware of it.
Absolutely. Absolutely. So, Dr. Aditi, since you spoke about hormone being one of the main factor contributing to, stress or even leading to many other mental health conditions, can we discuss a little more deeper on across lifespan, starting from, young girls and then to the adolescents, if there are any specific mental health conditions which are, girls being predisposed to certain mental health conditions, or adolescents, although you have spoken about it, can we delve a little deeper on it?
Okay. So if we just look at women's lifespans, it's not just the hormone. We also discussed that the presentation of the same thing might differ,
Right.
right, in men and women. So if we just start with childhood, let's take a condition like ADHD. Now, ADHD is a developmental disorder where our brain may take some time to mature. The trajectory of maturation of certain brain areas is a little different than most other children for these children with ADHD. Now, what happens in ADHD is these children may have 3 kinds of issues. One is they may be unable to focus
Right.
for longer periods of time on any given task.
Mm-hmm.
So that leads to difficulty in studying, classroom, finishing tasks, finishing homework, etc.
Right.
Or just sticking to anything that they are doing.
Right.
They are very distractible. The second part of ADHD would be hyperactivity.
Mm-hmm.
So these are children who are always on the go, never
Right.
able to sit down. It's very hard to pin them to one place. And, you'd get reports from teachers that this kid keeps disturbing the entire class. They keep getting up from their place, etc. The third part of it is impulsivity, where if they want something, they want something. I can't wait for it. They sometimes tend to be a little rash in their actions.
Okay.
Now, how it differs when it comes to boys and girls is that boys tend to be more hyperactive.
Okay.
That part of the issue is much more prominent in boys as compared to other
Right.
domains. So it's very easy to pick up because everybody would be complaining, this kid never sits down. Teachers
Okay.
would be like, just keeps disturbing the class.
Yes.
Like I
Yes.
said, even the parents would notice that it's very difficult to get them to sit in one place and do something, right? It's very noticeable. So it gets picked up.
They call the child to be very mischievous and
Very mischievous, very naughty, or parents tell us things like, there's like a motor in this child running.
Right,
It's very
right,
difficult to get them to
absolutely.
stop. And while these descriptions are interesting, endearing, the fact remains, okay, there is a problem, but it's been picked up.
right.
At least this
right.
part makes it easy to pick it up.
If it persists for a longer period of time, or is it picked up as early?
Generally, it gets picked up a little early, right? Because
Okay.
you can see it.
Right.
What
Right.
the others around us can see. It's easier for them to discern from it that there
Right.
might be an issue that needs to be dealt with. Now, when it comes to girls, what is prominent in girls when it comes to ADHD is attention deficit. So these may be children who are just sitting, trying to study and drifting off, daydreaming, not
Okay.
really focusing on what the teacher is teaching, not really focusing on the homework in front of them.
Right.
But that's not easy to make out, right?
Yes. Yes.
That's something they are experiencing subjectively, and children don't voice out their concerns. They don't even know it's a problem. They are
Right.
just drifting off.
Yeah.
So it happens very often that because of the difference in presentation, it doesn't get picked up in girls. These are just issues. I mean, just an example for children. Now, if we talk about a little older children or adolescents, we've already spoken about the kind of pressures
Yes.
they may be under and how it impacts their ill health. Now, it's not like depression is uncommon in adolescents,
Okay.
but again, how it may present in adolescent girls and boys may be a little different.
Okay.
So, again, girls tend to keep everything inside rather than
Right.
express it or take it out on things or people. So they become more withdrawn, quiet. They are quietly experiencing anxiety. Whereas when it comes to boys, you can see a lot more of irritability, anger outbursts,
Right.
experimenting with things, trying to cope that way. Substances,
Okay.
too much gaming, etc. Just trying to cope.
Right.
Right?
Okay.
So they can take it out and try to handle it that way. Whereas
Right.
girls sometimes don't have that avenue because it's also not socially acceptable
Absolutely.
for them. Now, let's talk about young women, for example. When we talk about adolescents and young women, one thing that is noteworthy here is for women from 15 to 29 years of age,
Okay.
suicide is the second leading cause of death across the world.
That's a shocking
It
piece
is
of
that
information.
common. So these are just differences in,
Okay.
how serious issues can be if they are not
Absolutely.
addressed. When it comes to young women, again, we have discussed all the pressures that they
Right.
might be facing.
Right.
And issues like depression and anxiety are fairly common. There are certain other mental health conditions which are not much more common in women. It's
Okay.
just that the age at which they present more often in men and women might be different. Say, for example, serious mental health issues like
Okay.
psychosis, schizophrenia, they may happen at different ages
Okay.
in young men and women. But we keep repeating again, like I said, about depression and anxiety.
Right.
It's fairly common. Women are much more vulnerable to common mental health conditions. Now, in young women, depression may manifest. It's been noted not just in young women. In women, depression may manifest more often as physical complaints, which are not, when you run the tests for them, everything seems to be okay, but they have a lot of aches and pains,
Right.
and that kind of physical health issues, which are not easily explained by. So that's basically just depression manifesting itself physically. It takes a toll on functioning all around, right? Again, now if we have already spoken at length about pregnancy and lactating mothers, postpartum period, 1 year after delivery,
Right.
and how important it is to address issues during that period, because if the mother is not doing well, the baby is automatically not doing well. The first 2 years of life are crucial for mother to bond with the baby emotionally. That's very vital for the baby's emotional development of their mental faculties in a healthy fashion. And anything that impairs it is going to harm the baby as well in the long run.
Right.
Right? So sometimes women do not address their own concerns saying, yeah, we can do it later. I will do it later. There are other pressing issues, concerns. I need to take care of others first.
Right.
But if you do not take care of yourself, you perhaps cannot be as effective in taking care of others.
Right.
Right?
Right.
Now, lastly, let's talk about menopause. So I mentioned previously there are disorders like schizophrenia, which present at different ages in men and women, but usually at a younger age. Women around the time of menopause, when their hormones are again changing, again are vulnerable to develop schizophrenia. There's a risk period in their middle age, which is not present in men. When menopause is happening, there are so many physical changes happening. There are hot flashes and all the discomfort that goes with it. That if women are developing any anxiety symptoms, they might be missed in the crowd of all the discomfort they are experiencing because they might look similar. Right? So it might just be taken as, oh, hot flashes. Happens to everybody.
Yes.
The anxiety that may be developing or increasing may just be missed. And again, because estrogen is neuroprotective, again, women can be vulnerable to depression. Also because these are not just periods of hormonal changes. These are also periods of role transition for women. Now, they are at a stage in their life where they have to take care of perhaps their parents who are aging. They have to take care of their children who are probably teenagers by now. And they have their hands full. They may be dealing with the changes in their own bodies and all that. It's a lot of stress.
Absolutely.
So a lot of factors come together to make women so vulnerable at so many stages in their lives.
Right. So you were also mentioning about the depression and pregnant women, and this is something similar to what I've heard as postpartum depression and the baby blues. Is it what you were referring to? And is it a transient phase or does it extend beyond?
That's a great question. Baby blues are very, very common, extremely common. So it's like when we take the example of just PMSing versus, a disorder, a premenstrual dysphoria or dysphoric disorder. That is a much more serious condition. It's the same with baby blues. A large percentage of women will experience baby blues because, again, the changes for the first 2 weeks after delivery. They might be anxious, they might be feeling a little low, they might find themselves to be in tears for no reason at all. Too many thoughts about, am I doing this right? Am I taking care of my baby right? Etc. But generally, baby blues tend to fade away by themselves after the first 2 weeks. If they do not, if they continue to persist, or if they are worsening even, perhaps it's time to seek help for it, because then it's not just baby blues. Perhaps it's evolving into a depressive phase. Right?
Will the family be able to pick cues from baby blues, or if women face any of these issues, is it easier for the family to pick these cues?
So if the families are a little more watchful, maybe they'll be able to pick up that women seem to be struggling when
Right.
it comes to taking care of their child and themselves. Maybe they seem to be emotionally a little more volatile. Maybe they are crying too often, or maybe they just seem to be in doubt. Like I said, am I doing this right? Am I a good
Right.
mother? Am I doing something wrong? Am I not able to take care of my baby, etc.?
Right.
If they feel like they are struggling, they have too many doubts or anxieties about themselves, maybe it's an indicator of something going on.
Okay. Does that require an urgent
Very
attention?
urgent.
It
I
does.
cannot emphasize how important it is, because it's not just the mother
Right.
whose well-being is at stake. It's also the baby whose
baby.
well-being is at stake.
Right.
So the sooner we address these issues, it'll help us in curtailing any damage in the long run.
Okay. So what happens if depression is left untreated in women like that?
Postpartum or
Yes.
otherwise?
Postpartum.
So anything left untreated will continue to become more severe. It'll continue to fester. Women are recovering in postpartum period. Her recovery would not be great, right? The lack of well-being can also affect their lactation. Lactation is known to be affected by stress levels. The mother may not be in a position to take care of the baby. Sometimes mothers start avoiding their baby.
Okay.
And because it seems too overwhelming, how do I do this? I
Right.
don't have the mental or physical energy to do this, which is something that can happen with depression.
Okay.
And then the bonding doesn't happen,
Okay.
right? So we are setting the stage for long-term issues for the baby, as well as we are leaving the mother's distress unchecked. It's just growing. Depression, when it becomes severe in mothers, can sometimes lead to psychotic symptoms,
Okay.
wherein they might start fearing, like, somebody might try to harm me, somebody might try to harm my baby, or they might have very rarely, and let's hope it doesn't ever come to that, very rarely mothers may try to harm themselves and the
Okay.
baby, because they are very, very disturbed. They don't even know what's going on,
Okay.
right?
Okay.
So the disease has progressed to a very, very alarming degree.
Okay.
So it's absolutely imperative
To
for
seek
well-being
help
of
as
women.
soon as possible. Right. Fair point there. So, how would you treat postpartum depression, owing to the fact that many are reluctant about, seeking help in the very first place? But then, when we look at the treatment aspect, I think sometimes, women are very hesitant to take medications, or women are hesitant to take treatment in the very first place.
That's
So, what
true.
would be the treatment approaches that you will have for these?
Okay. So, generally, the apprehensions that women have, even if they come to realize that, okay, I need help, or the family
Yes.
comes to realize that, she needs help, the apprehensions usually are, okay, you give her medications, she is feeding the baby, what
Yes.
about the baby's well-being?
Right.
Will these medications affect the baby?
True.
So obviously, when it comes to situations like these, we choose the safest possible medications.
Okay.
Right? So your care provider is obviously going to consider that and choose
Right.
the safest possible form of therapy for you, right? And other than that, just to be more safe, we also advise for certain precautions. Say, for example, this medication is to be taken in the night,
All
then
right.
perhaps give a 6-hour period between the last dose of medication and the next breastfeeding session.
Okay.
Perhaps you could express and store for feeding the baby in the interim, and
Right.
things like that. So we do take precautions. We make sure it's absolutely safe for the mother and baby.
Okay.
When it's feasible, logistically and otherwise, we can also, in very, very mild cases, go for therapy alone, so that medications do not come into play. But that's usually difficult to do because mothers don't have that kind of time.
Right.
With their hands are full with the baby, their own recovery, traveling to a clinic, or even sitting for online sessions, etc. They might
Right.
not have time for that.
Right.
So generally, it's simpler to give safe medications, cut the disease progression, and just ensure that things are controlled.
Okay. To sum it up, you say that it's very important for a woman to seek help if she suffers from postpartum depression, one. And it's also safer to take medications, which would, of course, be tailor made to, to the women, basis of the
how the situation dictates.
is. Absolutely. So how likely is it that a postpartum depression might evolve into psychosis?
If left untreated, it is likely. It's very likely that it'll become more severe as time passes, because all the stress that the mother is under is not helping the situation any, right? And if it becomes severe, it may just progress into psychotic symptoms.
Okay.
In that case, like I mentioned, the mother may start experiencing something called delusions, where her sense of reality might be altered a little bit. She might start fearing that, someone may harm her or the baby. People might be watching her. She becomes, mistrustful of people around her. She becomes really wary of everybody. In line with losing, sense of reality for this period. She might also experience something called hallucinations, where she might hear sounds or voices when they are not actually happening in her surroundings. It's all an experience in her mind. How it might appear to an onlooker is that she seems afraid, scared of something perhaps, not trusting people, or feeling, like I said, people may be dangerous. She may just sit by herself and talk to herself because she's responding to the voices, the experiences in her mind. This is a very alarming situation.
Absolutely.
Because she has crossed that threshold. She may no longer be able to care for herself or the baby in any capacity right now.
All right.
And if this gets any worse, there is a little bit of risk of harm to herself or the baby.
Okay.
Right? So this is a situation which cannot, where there's no time to lose. It's absolutely essential that she be treated as soon as possible. Now, when you ask me this question, we are talking about a depression becoming severe.
Right.
And there being psychotic symptoms.
Yes.
It's not as common as depression, but women may experience postpartum psychosis also without there being depression. They again have these experiences without features of depression preceding it. It is also likely that if mother had these psychotic symptoms previously in her life, they might tend to get worse.
Okay.
So her medications need to be watched and adjusted accordingly.
Okay.
Any pre-existing mental health conditions might worsen during pregnancy and after delivery for the reasons that we've already discussed.
Okay. So you also mentioned that there is a risk of self-harm or harm to the child. Would it be a good idea to separate the mother and the child?
It's never a good idea to separate the mother and the child. If we fear that the mother is not currently in a state to take care of the baby, what she needs is support to help her bond with the baby. There need to be people who can take care of the baby, but make sure the mother is around the baby.
Okay.
Give her, when she's able to, she should have access to the baby to hold, to care for in whatever capacity she can. Because this is not just about, taking care of the baby's needs. This is also about building that bond. It's not just, an emotional, ephemeral bond. It's something that is related to actual biological changes in the mother and the baby's brain that help them build that connection, which is absolutely essential for the baby's well-being down the line.
Absolutely.
We want to preserve that
as
much as possible. So if she is disturbed, if she's not able to, let her do whatever she can. If you're worried about safety, it can be done under supervision. Right? But it is not advisable to completely remove the baby from her care at any given point of time.
Fair enough. We cannot deny her
she just needs support.
Absolutely.
She doesn't need for her baby to be taken away.
Absolutely. So that also leads to another question, that families do have to support the mother. How will they be able to do this? How do they pick cues, and how will they support the mother?
I mean, like you said, new mothers need support.
Absolutely.
A very basic thing to do would be to just provide them the support they need so that their stress levels do not rise to the point where, it takes a toll on their mental health.
Right.
If we feel that our loved one, our family member is struggling, then they need even more support. They need help with everything that they're not able to do on their own, because it's not just, when we talk about depression, it's not just an entity. It's also about how mother is processing it all. To her, it may seem like she's a failure, that she's not able to take care of her own baby.
Okay.
She might not be able to understand that that's her experience of depression that's getting in the way. That further takes a toll on her well-being. So she needs even more support during such time. She needs, if she's not willing to seek help, because like we talked about misconceptions, families need to pave the way, make it easier for her to be able to seek help.
All right.
Make sure that medications are taken consistently, and anything else in form of support that she needs, and assist her in being close to the baby whenever it's possible for her, for however much ever longer period of time.
Right. Family plays a major role, not just during depression or not just during pregnancy and depression, but also otherwise or throughout our lifetime. So how much of a role should a family play? How can they support a woman across the lifespan when it talk about child or talk about adolescence? We spoke about, pregnant women now, but there's also another phase of life, which is menopausal, where even the kids can actually be a great support system for the mother.
Familial support is absolutely essential. All of us know that we need it. And that goes a long way in helping us manage the stress in our lives. And again, let me repeat this, that stress is a factor that will increase any emotional distress that we are experiencing, can contribute to development of a mental health issue if it is there for long enough, right? So families and in general support, our social support systems go a long way in mitigating that kind of stress if we can use them judiciously. So when we talk about women who are perimenopausal, and obviously with all the changes, they may be vulnerable, they may be struggling with change in mood, change in their anxiety levels. If they've already experienced an anxiety disorder or a mood disorder in their lifetime, then they are at a risk of it recurring or worsening. But the problem with we face with our elderly is sometimes they are not very willing to seek help.
Right.
Because they may harbor notions like, why should I bother my family at this stage in my life? I don't need to be cared for that much. They should devote their resources to the children in the family or something. I'm distracting them from their actual responsibility. And, it's like I have spent 60 odd years of my life just like this. Why do I need help now?
Yeah.
So just
being very neglectful.
Very, very negligent of their own healthcare needs. And more so when it comes to mental health, which is why it's when the elderly come to us, if they have depression, they do not even acknowledge a low mood, a sad mood or a flat mood. Generally, they come with physical complaints or anxiety, some sort of fears that what if I fall or something, and worries about being a burden. And generally, it's physical health complaints, pains, aches, physical difficulties that they focus on. So I suppose what the families can do is be watchful if you know that a loved one is going that sort of life transition, and perhaps try to gently coax them into seeking help. If not, at least provide them the kind of support that they might need. Loneliness being one big factor that leads to depression in elderly. Just addressing that perhaps may help them in the long run.
Thank you, Dr. Aditi. That was a very enriching talk. I feel empowered. And I'm sure all the audience watching us will also feel empowered. And this should enable them to seek help whenever there is a need.
Thank you, Kisra.